Okay, so we're almost done with chapter one, and then we'll move into chapter two. Sorry, I get like so lost in sharing with you guys this stuff that sometimes I'm like, oh, time. So, professional entrepreneurship, new models of nursing practice. So, we have nursing managed centers, case management, and advanced practice. So, of course, remember this is in 2013. So, a lot of this stuff you're like, this is not new, but it's newer, right? So, nurse managed centers. So, think about there's like individualized case management centers. You as a consumer can contact a private case management service and they can help manage your care or your family member's care. There's advanced practice nursing, which helps increase access. And nurse managed centers, think like the little clinic or even home health. And the expansion of patient education and advocacy. So there's actually something called integrative nurse coaches who can help people navigate the healthcare system. So the ANA released something called their health promotion as a unifying concept. And just the idea that it was kind of like, I mean, obviously in nursing, we've always been about health promotion. I think that's kind of the basis of our profession. But in this area, it was this idea that's like, hey, just FYI, public and to all nurses, yeah, we're all about the health promotion. And not only are we all about the health promotion, but we're good at it and we're going to transform healthcare. Just watch and see. So we have this code of nurses and we have this ethical commitment to health promotion. Um, Being there to educate and promote, to prevent issues and to maintain health and wellness. We are ethically bound to that per our profession. So where is this going? So forces that are shaping the future of health promotion. Well, part of it's an informed public. I mean, Subway commercials talk about obesity and what that causes. People are living longer, and now we have so much more access to information. So we have this increased chronic health problems that happen at all ages now, especially in the disadvantaged. So you think about, the rate of childhood obesity, mainly in low socioeconomic areas. We're getting kids with type 2 diabetes at age 12. Well, just know the number one cause of kidney disease in this country is diabetes, specifically type 2 diabetes. Most people, it used to be you're diagnosed later in life, like 40s, 50s. Now at age 12, if you don't control it, you're pretty much guaranteed to be on dialysis by the end of it all. And there's a greater need for disaster preparedness. And we've talked about this, and now you see on the highway signs about talking about being prepared for a disaster and protection from violence, because unfortunately, violence is a huge pervasive problem. The previous Surgeon General wanted to make gun violence a health policy, which informally it already is. The number one cause of death in the African American among African American males is homicide, the number one cause of death. So that's a health issue because that's a mortality issue. And so part of our health promotion is going toward talking about violence. And now with acts of terror and these group like attacks that are coming to the US and into more civilized, and I shouldn't say civilized, I should say more developed countries, there's a need to talk about protection. I mean, I'm sure many of you can attest there was a time where the whole idea of active shooter training was never a thing. And now it's a thing. We all get active shooter training, just like you get bloodborne pathogens and HIPAA training. We have active shooter training. And part of that is health promotion, right? So kind of the idea of what do we do to prevent injury, illness, and death. So framework for thinking about the future. So ways of thinking about the future. What may happen, what could happen, what will likely happen, and what do we want to happen, and what are solutions to that, and do we even have solutions in place? So framework for thinking about the future. So there's narrow perspective. So change is forced upon the people, just like this active shooter violence, like this was forced on us, right? This was never something we talked about in the past. And then again, wide perspective when there's changes motivated by people. So facilitating your role in health promotion. So proactive approach, becoming knowledgeable in all areas of health promotion, which we do as nurses, but this is our goal in this class and this is our goal for the public. Collaborating with others, focus on outcomes, cost, and quality. And I know it's hard. We don't want to talk about cost, but that's a realistic thing. I mean, the reason why we start mammogram screenings at 40 is not because most people's breast cancer happens at 40. I mean, that's part of it, but mainly it's the cost, right? Like, what is the cost benefit analysis on someone getting cancer before 40, breast cancer before 40, and dying from it? And if we were to decrease the mammogram screening at 35, well, it's that many more people getting annual mammograms, and that's that many more people with the cost, versus the cost of those who actually get it without knowing, late stages. It doesn't weigh itself. So that's why they come up with those ages. It's not because most people don't get breast cancer until they're 40 or no older. I mean, there's outliers in everything, but they have to look at the cost benefit analysis, which is kind of awful, right? Because for those of you out there who are like, yeah, I have 6, female relatives who have, breast cancer, and I have to pay out the wazoo for my mammogram screening because it's not recognized. Yeah, that stinks when you talk about cost analysis. Enhance sensitivities to diversities, and then use a wellness focus to guide practice. All right. So now we're going to talk about chapter 2. Now I'm just pulling it up. So we're going to talk about nursing concepts and health promotion. All right, so the concept of health promotion, this is not new to the nursing profession. It's evolved over centuries, and we can trace its roots to ancient times. Obviously, we know our fearless leader, Florence Nightingale. And for those of you who think, oh my gosh, Denise, you're obsessed with Flo. Sorry. I am. I just think she's an amazing woman. So it's integral to disease prevention, health maintenance, and restoration. So there's a difference between prevention and promotion, right? Prevention is you are literally preventing disease. Promotion is you're trying to make people as optimally healthy as possible. So without health promotion, you can't have disease prevention, you can't have health maintenance, you can't have health restoration. So health promotion strategies, we want to increase levels of well-being. So what we think is in shape or fine might not be really what is the optimal wellness, right? Increasing life expectancy. And here's that idea, we get into the ethical place. Obviously, life expectancy is important, but you have to weigh quality of life. But honestly, life expectancy has increased exponentially in the last 20 years. So it went from like 75 to 85 to 95, where it's expected that people are now living in their 90s, and not rare amounts of people, a good chunk of people living in their 90s, which is why, we get panicky about the nursing shortage when some of you are like, there's not a nursing shortage. I don't have a job, or I don't get it. It's just this idea that pretty soon we're going to have all this population living into their 90s and living well. We're going to need more people to take care of that and more money to take care of that. Decreasing healthcare costs, and then reducing morbidity levels. So decrease healthcare costs. Why? So that we can have better access. And also, if you're decreasing healthcare costs, you're increasing overall health because less people are using the system inappropriately. The way things are used inappropriately is when preventable illnesses or preventable chronic diseases are found in the acute phase, so tertiary prevention. And then reducing morbidity levels, meaning complications and the cost of those complications, right? So amputations account for 12 billion healthcare dollars per year and rising, and not to mention disability. How do we reduce morbidity levels? Well, talking about preventative issues with those who are at risk for amputation. So peripheral vascular disease, smokers, hypertension, and namely diabetics. So nursing and health promotion continued. The American Nurses Association's Code of Ethics for Nurses. So this was originally adopted in 1950. It indicates profession's responsibility to the public related to health promotion. It highlighted nursing's responsibilities to protect, promote, and restore health. One of the main things about nursing concept is that we protect, promote, and restore health. We go into the schools to protect the health of children, to improve it and promote it, and then to restore people who were in bad health. And it's focused on the provision of quality healthcare, giving the best, most well-rounded healthcare for everyone. Again, this code of ethics indicates that the profession's responsibility is literally public related to health promotion. And that is what Our Lady with the Lamp did, and Elizabeth Stanton, all those women in nursing and in medicine who came out and said, dude, if we take care of people's health before it gets sick, we are going to save a lot of lives. We're going to save a lot of money. And that's what nurses do. What they do, they put on their helmets, they put on their gloves, and they go out there and they weigh people and they teach people about sodium and fat. And it's not just going out there and giving CPR and handing doctors scalpels. It's the stuff. We go out there and we, when you see a research project, the research nurse is the main person out there going there collecting data, educating on the research project, because that's what nurses do really, really, really well. Sorry, I had to drink my water. So the American Nurses Association scope and standards of practice. So the reason why this is really important is going into the idea of we don't when you're working as a registered nurse, you're not diagnosing and creating treatment plans, but you are using nursing diagnoses and nursing care plans. And so health promotion in nursing is going to look a little different than that in medicine. And then we talk about the quality of nursing care and the profession's concern with accountability. So we keep each other accountable, obviously, through so many different things. We have continuing education and certifications, and we have our boards that we keep having to renew. And so in our profession, we want to make sure that we are keeping within standards. And part of that is when we have audits or joint commission coming in. And then obviously we talk about achievements of optimal health and how we measure those things. So there's metrics that we measure those things. So nursing and health promotion is in the global community. So Canada, as a leader, they're just really great at the idea of health promotion concepts and integrating concepts into health nursing practice. So Canada took the lead in introducing health promotion concepts. Canada has one of the most expensive healthcare systems in the world, and they have people still waiting for care. But they also have a healthier population in general, including in the rural. And when we were talking rural, we're talking isolated areas, like how we have isolated areas in Alaska. They have 10 times that amount in northern Canada. And those populations still manage to be healthier than ours in the United States. And then integrating concepts into nursing practice. And, the Canadian health system utilizes their nurses so much more, or we're doing it so much quicker and more efficiently in health promotion. So international health promotion talks about ensuring quality of life, preventing injury and diseases, and reducing need for medical treatment or rehabilitation. So that's just kind of the idea. That's just a global idea at this point. Ensuring quality of life, preventing injury and diseases, and also understanding, because medical treatment and rehabilitation is costly and hard to get to, we want to prevent those things, especially in a global society. So the meta paradigm. So paradigm describes what nurses do in practice. And the meta paradigm transcends all paradigms, right? So paradigm being our relationships to things. So we provide a global perspective of nursing, and it summarizes the meaning of nursing. So nursing meta paradigm. So human beings are viewed as open energy fields with unique life experience. And as energy fields, they are greater than and different from the sum of the parts, right? And they can't be predicted from knowledge of their parts. So human beings make, this paradigm. So humans are holistic, they're unique. Um, everybody, but the individuals are greater than just, all of the parts put together. And so, and patterns of communication are really important to understand. So the purpose of studying in nursing biological, psychological, spiritual, intellectual, and social cultural dimensions of human beings and the stages of human development are important to understand how it affects behavior and health. So for those of you, when you took your human development classes, you're like, oh my gosh, why do I need to take this? I'm going to be a nurse. Why am I taking psych? I'm going to be a nurse. And part of that is you have to understand, because the whole person, the whole human being is part of our paradigm in care. And so that's what differentiates us from the medical model. We take into consideration human beings and what makes a human human, their environment, their situation, their population, their ethnicity, in the approach to taking care of them versus diagnosis and treatment. I mean, that doesn't mean doctors and PAs are wrong, because that's the medical model. It's just a different approach. So when we talk about meta paradigm concepts, human beings, environment, health, environment is a landscape and geography that we as humans experience. So it's not just, the air you breathe, but maybe the social environment that you're in. And nursing has to take that into consideration when you're considering how to take care of people. So these are dimensions that affect health and include, physical, psychosocial, cultural, historical, and developmental processes. And these all affect your environment. And then health is this dynamic process. It's changing, it waxes and wanes, and it's a synthesis of wellness and illness. And it's definitely defined by perception, right? If someone thinks that their health is bad, it's going to definitely affect the way a client perceives other things. So the nursing practice, this is an academic discipline. It's a professional practice. It's art and science of holistic health. And we're guided by the values of human freedom, choice, and responsibility. So nursing science is a body of knowledge arrived just through theory development, research, and logical analysis. Nursing and other supporting theories are essential to guide and advance nursing practice. The art of nursing practice actualized through therapeutic nursing interventions. So this is that whole idea that we use critical thinking and clinical judgment to provide evidence-based care to the whole family, to the whole patient, including their individual status, their family, their community, their environment, and their perception of their own health. Okay? And within this paradigm, there's learning that we talk about and the way it affects other people and their ideals of health. So it identifies categories of knowledge relevant to nursing practice and used by theorists to define nursing. So the concept is generalized notion or idea useful in describing facts or occurrences. So theory are relational statements to present a systematic view of a phenomenon, why people do things, why things occur the way they occur. It uses facts, definitions, and propositions, and describes and explains, predicts, and controls phenomena. So they're basically these beautiful formulas where you can calculate what's going to happen. So conceptual framework describes and or illustrates those concepts that are interrelated and central to the understanding of a phenomena. And it provides a way to shape nursing and nursing practice into a meaningful configuration. So nursing meta paradigm concepts are the person, health, environment, and nursing. So the concept of person, so they're recipients of care, they have holistic needs, biological needs, spiritual and psychological, social and cultural being. They think critically. A person interacts with their environment and primary participants in the nursing process, and every single person's unique. So when you think about the meta paradigm concept, we think about Maslow's hierarchy of needs, right? So you have your physiologic needs that have to be met first. From the bottom up, one level has to be met before you can move up to the other. Then you have safety and security, love and belonging, self-esteem needs, and then self-actualization.